Good afternoon. My name is Ryan McCory, and I work at Centera Lee in the emergency department. Today, I've been asked to speak briefly about a very important issue that I know a lot of health systems across the country are dealing with, as well as ours here at Centera Lee, specifically in the emergency department, and that is workplace violence. And what can be done about workplace violence? And is there anything beneficial that is coming out of the bill, the Workplace Violence Prevention for Healthcare and Social Service Workers Act? This is a bill sponsored by Representative Joe Courtney. It is currently passed the House and is going to the Senate next. But first, I want to rewind back to Valentine's Day of this year.
Office 911, where's your emergency?
Hey, hi.
Hello.
This is with the Centera Lee Emergency Department. We had a patient that's not stable mentally. She just checked into our emergency department.
Okay.
All of a sudden, she was in CAT scan. She jumped off the CAT scan table, became combative, ran into the cemetery behind the Centera Lee Emergency Department, stole a gentleman's car.
Okay.
She's definitely at risk to herself and others.
It's quite surreal to listen back to that 911 call that was made by one of our seasoned nurses in the emergency department that day. That patient truly was a danger to herself as well as the general public. Now, we look back on these situations and we often forget, right? It's becoming all too common in the emergency department where you just start to assume that verbal abuse and sometimes the possibility of physical abuse is just part of the job. There are no set standards that kind of cover each department. There are general guidelines, and Centera offers certain classes as well as something handled with care, but it's not enough. So what will this bill actually do? So I don't think it's a secret within the health system that violence or aggressive patients or abusive patients, these things are becoming more and more common. Centera recognizes this. Even on May 12th, just about a month ago, our team within the hospital was asked to stand for 72 seconds in a moment of silence to represent that 72% of workplace assaults in the United States occur within healthcare. This is a growing epidemic across the United States. Nurses report being punched and kicked and beaten. A nurse at Riverside just a few months ago was stabbed multiple times by a patient. So, what is this bill going to do for us? Well, it's hard to really say. One thing that it would do is this would set a standard that would require all covered employers to develop and implement prevention plans to reduce workplace violence incidents. Right now, if you were to ask a majority of the staff, well, what works in our ICU doesn't really work in the emergency department. So there needs to be comprehensive workplace violence prevention plans, and this needs to be a must. So what are some potential solutions? Well, currently in our emergency department, we would call a security alert, and usually the staff that surrounds that patient can usually de-escalate that situation. Further steps that I would like to be seen accomplished would be, can a report of that security alert be posted within Epic? So if a patient checks back in and they have a security alert, can that be in a column so we can see that as clinical staff, especially in the emergency department where we don't know, is this patient acting abusive because there is something medically wrong with that patient, psychologically wrong with that patient, and it's very unknown what classifies as medically clearing a patient. So some steps to finding some solutions. I would like to see, instead of this being looked at from a level of ED management or ED directors, I would like to see, can we establish some sort of a committee that involves every person that works within the emergency department, going from registered nurses to LPNs to ED techs to environmental services to transport to registration to patient safety partners, patient care advocates. I believe everybody should have a say, especially in a department that is as large as ours. I think finding a solution that can enforce policies consistently, that also establishes clear policies. So clearly it's not a secret that there's an increase of verbal or physical abuse on healthcare staff members. What this bill will do is it will almost force employers to develop these comprehensive plans so that there's strategies and policies that are followed consistently. What we can do at Sentara right now is we can have a committee that is based of our ED staff from all different levels to have their input on this type of plan and what they find acceptable. Thank you for watching.